Breast cancer remains a very common cancer globally. It is the most common cancer in sub-Saharan Africa. The Fred Hutchinson Cancer Center and the Uganda Cancer Institute has had a over decades-long collaboration working on research and training. In part of this collaboration, we recognized the burden of disease for breast cancer and the need for further investigation. And so this is a study of 100 women who were enrolled between 2018 and 2021 to identify the mutational profile of breast cancer in Ugandan women. The reason we thought that this is particularly important is because the women in Uganda who present with breast cancer do so at a younger age, roughly 12 to 15 years younger than the median age in the US. In the early 40s is when they present. And they present with advanced stage of disease. And so we suspected there could be some mutations that are driving this cancer. And in fact, we did see that. We saw that 48% of women had a mutation in either BRCA1 or BRCA2 mutation, a somatic mutation. 65% of the women had a mutation in TP53, and a sizable percentage, 35% of women, had a mutation in a PI3 kinase. And we think this is particularly important because it potentially would allow for targeted therapies that currently may not be so accessible in Uganda, but with the hope of this kind of data can inform targeted clinical trials. Right now, we have roughly a one-size-fits-all therapeutic approach to treating certain cancers, including breast cancer in Uganda, with chemotherapy. These mutations may allow for more precise precision medicine with targeted therapeutics, which includes the provision of oral medications, which may be more easily accessible than IV therapies. And that's the case in Uganda, other countries in sub-Saharan Africa, and also rural areas in the US and other wealthy nations as well. So I think trying to identify opportunities where we can increase medications to patients at need where they are would be a beneficial thing.